Greetings from Rome.
And hello from Geneva, everyone. Every year, the Food and Agriculture Organization of the United Nations, or FAO, and the World Health Organization, or WHO, jointly lead the celebration of the World Food Safety Day.
Because we cannot have food security without food safety.
And because globally, 1 in 10 people are affected by foodborne disease every year.
On World Food Safety Day, we remember that food safety is everyone's business.
And that by working together, we ensure our food is safe to eat.
But in exceptional situations, even if we have all played our part, the unexpected can happen.
Unexpected food safety events can range from minor events to major crises. But even then, there's always something that can be done to keep food safe.
Governments and industry must have plans in place in case of an unexpected event and ensure that no time is wasted in implementing the necessary actions.
The rapid exchange of information, effective communication, food safety management plans, and decisive action by food operators all help save lives.
Anticipating the kind of events that might occur, whether it be a natural disaster like flooding, or a volcanic eruption or a power outage, can ensure the risk to food safety is minimised.
And at home, consumers' food safety knowledge can avert problems in unexpected situations.
This World Food Safety Day, we will raise awareness about what you, no matter what your role, can do to be ready for the unexpected.
Please
get ready
and join us on the 7th of June.
Thank you for playing that lovely video. I promised you a few minutes ago that this is only going to get more interesting. And to actually give you a flavor of that, we have the WHO team who have devised a very interesting interactive quiz for all of you. So let's get that going. So over to you, Jessica.
Thank you very much, Cedar. Welcome everybody to our World Food Safety Day 2024 celebration. I hope that you all can also be able to interact with us for a while. So we have prepared a Mentimeter in which I hope the team would be able to put that in the screen for us so you can access and connect with us to go through an icebreaker. It's just a quick round of questions with interesting facts about the topics that we are going to be approaching today.
You will share the screen, right?
Sorry, I cannot hear you.
Absolutely.
I think we're just undergoing some technical points here, but we are trying to fix it.
Is it okay, Jessica? Can you see
Yes,
that?
I think we need to put on the presentation mode so we can go through.
Okay, just a minute. Is it okay?
Not really.
No? Okay. I'll check again. Now is it okay?
There we go. I hope so. So colleagues, if you're able to access with your phone through the QR code that is on the screen, or you can also connect to the Mentimeter website. While we take time for some colleagues, we can see the numbers raising and connecting, which is great. And there we go. If you have any issues, feel free to reach out to the team through the chat. But so far, we still see the numbers increasing there and more colleagues connecting. Okay, I think we're good to start. So Syed, if we can start and move to the next, to the first question. So just for us to get a little feeling of where you're coming from and which sector you're representing, we're all aware, and we also heard from the Regional Emergency Director, that food safety is also something that demands multi-sectoral actions. So it's very important for us to know who is connected and which sector we're coming from. We have colleagues joining from different food safety agencies, colleagues from the Ministry of Health, and you also have a feeling of the different representatives that are going to be composing our panel later, with different backgrounds, different expertise, but all contributing for food safety. And we see today that we have a good amount of colleagues from the private sector, which is also great, government representatives, and others to come. So Syed, so if we can move to the next one. And we have colleagues joining, which is great, numbers increasing. So we have prepared a quick quiz to everybody so we can further discuss some interesting topics for food safety, also related to this year's theme. I think we didn't went through the question set, so maybe just go back.
Okay. Oh, who
Yeah.
is?
And you need
Okay.
to put, yes.
So,
And you press enter on the bottom to start the quiz.
okay, then that's the first bit of questions.
Okay, if you actually pay attention to the information that was given in the beginning of the speech from the Regional Emergency Director for WIPRO, you might get this one right. And we end up with 2 participants that also got it right. So the right answer is 600.7 million of death that we have per year related to foodborne illnesses. And more than, so the right amount is more than 600 million people fall ill and 420 million die every year after eating contaminated food. And the most interesting fact from that is that 30% of foodborne deaths occur amongst children that are under age of 5. And we do have the at-risk populations, as mentioned, young children, infants, but also pregnant women, older adults, and people with weakened immune system that can also be strongly affected by foodborne diseases. So next question, Syed. And gathering the players that are already ready. So also another important point, impacts on productivity and medical expenses resulting from unsafe food consumption in low and middle income countries. And the right answer, around 110 billion USD, American dollars, are lost every year when it comes to productivity and medical expenses. And all that is also related to the treatments and types of support that needs to be provided to the different patients, especially when it comes to diarrhea reporting, and how much of these are being affected and caused by the ingestion of unsafe food. Next question. So food safety hazards, we're talking about emergencies, we're talking about preparedness for food safety incidents, and what type of hazards that can actually trigger or cause a food safety incident. So we have a wide variety. We have many different types of hazards. And yes, you are mostly all correct. All of these can be considered food safety hazards, and they can trigger food safety incidents, including food recalls in different countries. Next one. And we will have the chance to talk more about food recalls throughout our event today. One specific type of chemical hazards. What are the types of chemical hazards that we can find that can affect food? We have a lot of different options. I'm pretty much sure that most of you also might have heard about the impact of these different chemical hazards, and even implicating sometimes in trade ban. So becoming a commercial barrier for different countries when it comes to chemical hazards. So well done, all of the options. Next one. Talking about microbiological hazards, we have so many different microbiological hazards that are of concern for food safety. And this question is basically for us to bring the different types of microbiological hazards and the different types of food. So we do have different types of bacteria, sometimes viruses like noroviruses. We have parasites and like trematodes, but we also have prions. Who never heard about the mad cow disease? That it's an animal health disease, but it's also affecting the food safety aspects of what we consume. And not to mention is E. coli, salmonellosis, and all the other microbiological pathogens that can affect food. Next one. INFOSAN. We've heard about INFOSAN in the beginning of the Gina's speech today. So what does the acronym, this big acronym, stands for? So INFOSAN, also one secretariat and one action, joint action from FAO and WHO to support the different member states and food safety authorities in composing this international network. So we will have the chance to further discuss about INFOSAN later. Next one, Syed, to complement this question. So it's a big acronym, but also for a big important cause. And interesting aspect, how many member states and how many countries food safety authorities are part of INFOSAN? How many authorities you think that are jointly putting efforts to timely respond and timely communicate food safety incidents worldwide? And there you go, 189. It's already a good amount of food safety authorities, but we are often seeking to expand and to increase this type of collaboration to support international actions towards food safety emergencies. And of course, to strengthen the collaboration with IHR, International Health Regulations, National Focal Points. Next one. And what does INFOSAN do? What is the role of INFOSAN during a food safety emergency? What is INFOSAN taking action on to support the member states and the different food safety authorities worldwide to contribute to public health? And yes, all of the options. So the information exchange, support on that, be able to quickly and timely communicate so the different food safety authorities can take actions on a timely manner, and also support them to strengthen their capacities, especially in building emergency plans for food safety incidents. Next one. And different situations in which food can become unsafe. We are talking about different scenarios that can affect food and can also not implicate only on food safety, but also implicate on food security. So the availability of food. And we are mentioning a lot of different natural disasters, but also what natural disaster can cause. So power outage following a flooding situation, fires and volcanic eruptions that might affect food, different hazards towards different situations. And well, the teams had also been working towards supporting actions during emergency situations, including natural disasters, and we will be able to share further in the chat later. Next one. And of course, we cannot talk about food safety without bringing the One Health approach. So from your point of view, which sectors should be involved in food safety actions? And I think that today we will have a couple of colleagues and a couple of panelists that are going to be sharing further on how they operate at their level, at national level. And this is not a right or wrong answer. I'm also not sure how many of the colleagues are able to connect, but we need to also bear in mind that we are talking about the whole food chain and its implications in food safety, and also the amount of different stakeholders that we have that are contributing towards the food system, but also towards food safety. And yes, we don't have a formal answer to this question. Basically, each different country will have a different way to collaborate with the different stakeholders that are acting towards food safety, especially when we take into consideration that it starts from the farm and it ends in the fork. And we are all the end users, the end consumers of food. So as much as we have the right and the relevant stakeholders involved, the better. So multi-sector collaboration can be contributing towards ensuring food safety. And I think we will stop here. I would like to thank you very much for your engagement and your participation in this Mentimeter, in this icebreaker session. And I will hand it over to Sridhar to continue with our agenda. Thank you.
Thank you, Jessica, and to the WHO team for a very interesting Mentimeter quiz. And I think some of the messages here are pretty stark. We heard some of those numbers which are even mentioned in the opening remarks, like 600 million people and many other statistics. And you can all realize that in many ways, this is an issue which goes on silently, and we need to pay much more attention that we are doing now. And that, in a way, is the purpose of today's event on World Food Safety Day. So to explain further on this issue, we will now hear from Gyanendra Gongal, who is the Senior Public Health Officer at the WHO, World Health Organization, South and Southeast Asia Regional Office in New Delhi, who will talk to us on the FAO-WHO framework on food safety emergency response plan and INFOSAN, the International Food Safety Authorities network. So over to you, Gyanendra.
Good morning, good afternoon, good evening. It is my great pleasure to make presentation, Food Safety, Prepare for the Unexpected. And FAO and WHO recognize reinforcing preparedness is a key element of any emergency related activities. So food safety, definitely, even when all steps to ensure safe food are followed, in exceptional situations, accident can happen and food safety can be compromised. There is always something we can do to minimize the risk and reduce the impact of foodborne illness. Here, preparedness, rapid response of information, food safety management plans, and rapid action are key to reducing illness-related cost and impact on livelihood. What are the facts, figure, why we are talking about foodborne illnesses? 1 in 10 people worldwide fall ill from contaminated food each year. More than 200 diseases are caused by eating food contaminated with bacteria, viruses, parasites, or chemical substances such as heavy metals, naturally occurring toxin, and persistent organic pollutants. Particularly children under 5 make up 9% of the population, but they carry 40% of the foodborne disease burden. What do we mean by the unexpected? Food safety incidents is beyond business as usual. It may escalate or might be easily addressed. Food safety incidents can range from minor events to major international crises. Food safety incidents can be due to an unexpected event leading to contamination or causing a breakdown in food safety control, that is power outage or flooding. In an interconnected global food supply, risk posed by unsafe food can rapidly evolve to an international emergency. Here in the graph, we can see that we can scale up or scale down the response based on situation. If there is crisis, we scale up. If it is business as usual, we can scale down. How can we be ready for the unexpected? Food safety is a shared responsibility. Government, food business operator, and consumers can play their own role. So from government sector at food safety regulator, develop or update national food safety emergency response plan, strengthen national food control systems, increase surveillance and coordination capacities, and improve communication, particularly during food safety emergency. Food business operator has to improve food safety management plan, work collaboratively with each other, improve communication with consumer. And consumer has also important role to play, know how to respond to a food safety alert, that is food recall, how to know how to report a practice that can impact safety of food and potential foodborne illness, and understand the implication of unexpected food events. Multi-sector collaboration in ensuring an effective response, that is very, very important. Food safety is everyone's responsibility, and multi-sector approaches are the most important means to combat food safety incidents. A coordinated approach across government agencies, national authorities, and food industry, particularly private sector, helps minimize public health risk. There are 2 important things during food safety emergency, that is fast and accurate information sharing among all relevant partners that helps identification of the nature and origin of food safety events. and we have to provide accurate, open and timely information to food safety to all stakeholders that maintain confidence in food supply. So there are rumors and there is different social perception that we have to keep in mind while developing risk communication messages. What is the role of WHO and FAO in food safety emergency response? FAO and WHO provide food safety prevention and response preparedness tools. For example, technical assistance in the development of food safety emergency response plan. And there is a guidance document framework for developing such documents. And INFOSAN, International Network of Food Safety Authorities, facilitates the rapid exchange of information across borders and between members during food safety events. And FAO WHO Codex Alimentarius Commission develops and adopts guideline to support emergency and preparedness and response. There are principles and guidelines for the exchange of information in food safety emergency situation, including recommendation on rapid, international and cross-sectoral information exchange that lead to the creation of FAO WHO International Food Safety Authorities Network. And there is also guideline on the management of food biological foodborne outbreaks. These are all codex documents. How INFOSAN protects consumer health from risk posed by unsafe food? It is a global community of practice working together for safer food around the world, and it halts the international spread of contaminated food, prevent foodborne disease outbreaks, and strengthen food safety system globally to reduce the burden of foodborne diseases. It was established in 2004, and this year we are celebrating 20 years of existence of INFOSAN that has facilitated rapid exchange of information, and there are 189 member states and more than 8,000 registered members. When does the INFOSAN Secretary wants to be notified? Outbreak of foodborne illness linked to imported or exported food. That is basically related to biological agents, and there is also contamination of food or feed which can be imported, which has imported or exported and is likely to cause human health risk. It is basically food residue monitoring system, and it is chemical or radionuclear contamination. How INFOSAN works, how INFOSAN alert is posted. There is a standard operating procedure. We receive information and we draft INFOSAN alert, and we consult with National IHR focal point and INFOSAN emergency contact point and FAO WHO regional office and focal points, and we do rapid review and feedback from national authority and also private sector which produce and distribute internationally the products. There is verification process, and after that we post in INFOSAN community website, and all INFOSAN members are notified. This is the website of INFOSAN community web page. So here you can see incidents like unauthorized substance chlorpyrifos, that is an insecticide found in banana from Ecuador, and there are also other examples which we can get from INFOSAN community web. Number of stint over the years to INFOSAN. So in last 10 years we have received food safety incidents where INFOSAN Secretariat has intervened. So the number is increasing, and that means more and more events are happening, and we are reporting and we are acting. What are the examples of food safety emergencies in Asia? In 2007, baby corn was exported from Thailand to Australia and Denmark. Shigella sonnei was found, and in 2008, melamine contamination of milk and milk products, particularly infant formula, China to Hong Kong, Singapore, and many countries. And 2011, radionuclear contamination due to Fukushima nuclear disaster, monitoring of food radiation, and export ban. This is an example of food safety emergency due to biological, chemical, and radionuclear threat hazards, and that's why it is linked to international health regulation. Multi-sector approaches for food safety emergency, that is very, very important, and there are 4 FAO WHO publications on risk analysis, risk communication, recall, as well as food safety emergency response plan. So risk-based inspection and monitoring with specific hazards to detect emerging microbiological and chemical contaminations such as mycotoxin, pesticide residue, and shellfish poisoning. And climate change is also another factor which is increasing food safety risk. Integrated data and information management and analysis for food safety surveillance to enable assessment of emerging foodborne disease risk. Food safety emergency preparedness response plan, rapid communication and information sharing through INFOSAN emergency contact point and national IHR focal point. And we have to develop not only plan but do simultaneous exercise to test function and coordination among national stakeholders. And this is WHO standard we have developed to understand how we can play important role during food safety emergencies using IHR and other mechanisms. Thank you.
Thank you, Gyanendra, for that very informative presentation. So, dear participants, just wanted to mention 2 things. One is Gyanendra is actually online, but he recorded this presentation in advance because he's in a location where connectivity is weak. So thank you, Gyanendra, for doing that. Second, if you have any questions to any of us, all the panelists whom you will hear very shortly, and any of us working for WHO, FAO, you're more than welcome to post them on the chat or on the Q&A. So we will try to answer as many as possible today. And if we can't complete everything today, we'll then follow up by email. But again, please be this is meant to be interactive as much as we can on a Zoom platform. It's not very easy, but please do go ahead and ask any questions in the chat as we go along. But here's where we now start to hear from our regional experts, from the various panelists around the region. And to start that off, we will first hear from Dr. Hidetaka Kobayashi, who's the Coordinator, Risk and Crisis Management, Food Safety and Consumer Affairs Bureau, Ministry of Agriculture, Forestry and Fisheries from Japan. Now, Hidetaka-san is very well known to us in FAO and WHO. He's worked with almost all of us. His advice is very strongly relied upon, particularly by the Codex Alimentarius Commission. And he has very kindly agreed to share some of the country experience from Japan on food safety incident management. So over to you, Hidetaka-san.
Thank you for the invitation to this very important event and give me an opportunity to make a presentation at this important event. Okay, so is my screen shared?
Yes, it is.
Okay, so I start. Okay, I'm going to introduce about the food safety incident management in Japan. This is okay. Of course, food must be safe as explained in the earlier presentations. So in general, when we talk about food safety, we use generally narrower image, like to protect from natural or intentional hazards. Hazards are such as heavy metal or pathogenic microorganisms, so sometimes pesticide residue or something. And in this field, the Codex has already done a lot of works. On the other hand, there are different kind of crises on food. It is the intentional contamination. It is a kind of crime or bioterrorism, but we also have to tackle with that kind of issues. That kind of activity is called food defense here. And food defense is also the important part of to make food safe, and we have to be prepared for that. Otherwise, it is quite difficult to deal with that. Now, this table shows what's different between food safety and food defense. For food safety, it is deal with food safety standards. But for food defense, we cannot set standards because it is intentional contamination. So, of course, criminals do not follow the standards. And in many cases, food safety issues, the hazard concentration is not so high, generally less than 0.1 milligram per kilogram, for example, for contaminants or pesticide residues. On the other hand, for food defense, it is quite a different situation because they intentionally do something to make confusion in the society. So they put a lot of hazard on food. So typically the concentration is quite high, like 1,000 milligram per kilograms. For food safety issue, it is quite usual event as already explained before, but food defense event is not usual, but still important. And in many cases, especially for food safety event, besides the microorganism issues or marine biotoxin issues, generally the toxicity is chronic toxicity. So they are considered to be safe if the intake is less than ADI. But for food defense, like this high concentration, acute symptom, including death, will occur. Now I'm going to introduce a case study happened in Japan in 2013. It was pesticide contamination in frozen food. A frozen food company received many complaints from consumers due to nasty smell of organic solvent. But at that moment, the company did not recognize it was a contamination of pesticide, whatever. So they didn't deal with it quite seriously. So the company analyzed some frozen food collected from consumers, but it is 1 month later. Then they found that these frozen food contained up to 15,000 milligrams of malathion. Malathion is a kind of pesticide. It is insecticide and organophosphate. So it is relatively toxic compound. Generally, the residue of malathion is like 2 to 8 milligram per kilogram. It is MRL set by CCPR. But in this case, the contamination, the concentration is 15,000 milligram per kilogram. So it is quite very, very high concentration. The company, frozen food company, decided to recall all frozen food produced in the factory. The impact was very big because they had to recall 80 million food items of 88 kinds of products, and they had to pay 5.8 billion Japanese yen loss to the company, and then they had to suspend of operation for 7 months of that factory. So it is quite a big incident. So why it happened? An employee working in the factory brought pesticide malathion from his home and then sprayed on various frozen food on several different days at the production lines. So the contaminated frozen food appeared sporadically because only the products he put pesticide on it were contaminated, not all of them, but it is quite sporadically, and also the factory produced 18 kinds of frozen food, so various frozen food are sporadically contaminated. Why he did it? The employee was dissatisfied with decrease of salary. And actually managers hardly communicate with workers, so managers did not know if workers are dissatisfied. So that these are the cause of this incident. What the company did. The first complaint was received on 13th of November, and after that, the company received 19 calls about the similar complaint. But at the beginning, the company did not consider it was intentional contamination, so they analyzed the collected sample more than 1 month later from the first call. So the frozen food were distributed all over the Japan, then stay in the shelf, stay on the shelf for almost 1 month. The analytical result, 15,000 milligrams per kilogram, were confirmed on 29th of December, so almost at the end of the year. So then they stopped operation and started recalling product. But unfortunately, in Japan, the year-end, year beginning holiday is from 29th of December to 3rd of January. So many shops are not in the good shape, or even the company are not in good shape to communicate with others. So it was a kind of the difficulties to deal with that. The company reaction was, the other issue was they announced a message about that, but an incorrect message was publicized at the first press conference. That was, no symptom is expected unless a child with 20 kilograms eats 60 pieces of pizza. Maybe nobody eats 60 pieces of pizza. So, it's not a big issue. But 2 days later, they changed the announcement. Symptom may occur if a child eats 1/8 piece of pizza. It's completely different. 1/8 piece is possible. So then it's a kind of confusion. Because why they mistaken that kind of calculation? Because at the first stage, they calculated based on LD50. 50% of mice die. But it is not a correct index point to calculate for the toxicity. Then many people or government pointed out to the company, and then they corrected 2 days later. Calculation was based on acute reference dose of 2 milligrams of kilogram body weight. Then the completely different result was announced. So it created a issue. It created a confusion as well. After the incident, investigation committee found 7 defectives in that company, 7 main defectives. First of all, big and complicated organization. That company is very big, and also it was quite complicated. So the person or division who takes the responsibility was not very clear, and information was not shared properly. So only people in factory know it, but the parent company did not know at the last moment. So it was an issue. The second one was underestimation of importance of the incident because of the incorrect message, or they are not quite. The lack of scientific knowledge created such kind of problem. The third one was delay of announcement of the incident or recall, because they analyzed 1 month later. So announcement was made 2 days later from when they know pesticide contamination. So still it is late. And delay to grasp the situation. It took more than 1 month to know the situation since the first complaint. If they send the product for the analysis at the first call, they were able to deal with that situation 1 month earlier. So situation should be much better, but actually it was not good. 5, problems of facilities. There are a lot of problems in the factory. For example, it was easy to bring anything into the factory. So the employee, remember, so the employee was able to bring pesticide from home to the factory, and then they sprayed it on the food. it was quite unusual because in general, at the entrance of factory, all workers should be checked, but at that moment, the factory did not check what they have. Oh, sorry. Then lack of a sense of responsibility and insufficient response to complaint. Before the incident of the pesticide, many cases foreign object contamination were reported, like toothpicks, stickers, or something like that. If they thought that it was a problem, the incident would not happen. But actually, they missed just to refund to the consumers, and that's all. Then they did not investigate what was the source of the problem. So it was a problem. But actually, it was not the only case in Japan. There are many incidents happened. For example, Guriko Morinaga incident 1984, Wakayama curry incident 1998, frozen dumpling incident 2007. These three big cases are listed here, but similar smaller one happened more often. So this kind of incident may happen. Also, this kind of incident may happen in other countries, in many countries. Actually, much more happens in the United States, for example. So food defense is necessary to protect not only to consumers, but also the producer, distributor, shop, restaurant, or whatever. Because remember, the company, how much money the company had to pay. So it is a quite big issue. Fortunately, the company is still in the market, but it was quite a big issue. So in Japan, we produced the food defense guidelines. This is developed by a government-sponsored research project, and it is on the website I will show you later. It is for food industries. And actually, food defense is quite voluntary matters because what is mandatory, it is quite difficult to say, because if criminal doesn't exist, we never need it. So how much they have to spend on that depend on the company. So it is voluntary matter, but many large industries take into account these guidelines. Small businesses are hardly aware. This is the current situation. This is the current issue. Some materials for the food defense guidelines are written in English, so maybe you can make use of them. What is written? Food defense measures share the information on measures taken for food defense among managers on food providing facilities, food sanitation, and personnel, etc. And designated a person in charge of food defense. Who is in charge of food defense? It should be clarified. And identify visitors and confirm if they bring something in the factory. Sometimes visitors can enter to the facilities without any check, but it is not a good idea because also visitors may do something bad. And lock entrance storages, refrigerators when they are not in proper use. So only authorized person can access to these areas. The second, organization management, employ trustable personnel, and enforce 5S. It is sorting, setting in order, shining, standardizing, and sustaining the discipline. Educate workers to understand food defense. Record workers' conditions, division of role, etc. And give opportunities to work who want to complain, like suggestion box, for example. And preventing contamination measures are like identify vulnerable parts and share information on measures to mitigate the vulnerability, inspect delivered ingredients and other materials to keep them secure, store detergent, insecticide, etc. securely because they may be used in the factory, prohibit workers from accessing unnecessary area. For example, workers to cut vegetables should not go into the other areas like to shipping area, and allow only limited items bring into the facility. Conclusion is, incident may have a significant impact not only on the business but also on the society. Actually, it is not only the business itself but also the society. In that case, frozen food was quite many people avoid using frozen food because of that incident. And consider food defense as a management issue, not at the on the spot, but the management or quite big administrative issue. And not only an outsider, but also an employee may commit offense on food. Actually, many cases, that kind of incident happens caused by employee, like this case. So, of course, avoid an authorized person from entering production area, even they are workers of that company. They should be avoided if they are not in charge, and prohibit workers to bring their belongings without permission into production area. Once an incident may occur even if they are quite careful. But in that case, quick and accurate reaction is the key. If consumers are correctly informed about the incident, they will not eat the products. Then we will see no health issue. So the incident is much smaller than expected. So announce correct information to consumers and recall are the key. And finally, balanced approach is important because food defense is quite important. But if we spend a lot of money on food defense, we cannot get more money. Just food defense does not make money. So, but still it is necessary. So how much we have to do depends on the management issue rather than the we don't have the answer to all of them, but answer to each company. This is the final slide. There are some more resources to learn about food defense. The first one, Nara Medical University website, shows the guidelines in Japan, and the second one is US FDA site, and also terrorist threat to food in WHO site are also for the reference. Okay, thank you for the listening to my presentation.
Thank you, Hidetaka-san, for sharing that. First of all, Hidetaka-san, and to all participants, let's first appreciate the frankness and candor with which Hidetaka-san shared this information with us, because these are not easy things to relate or to put out in public, but he has done that for the benefit that we can all learn from this experience, and we are better prepared for the unexpected now and in the future. So thank you for doing that. The important thing is, of course, he made 2 points, which is when we have such unexpected incidents, whether they are due to a criminal act or whether due to an accident, the potential for loss, so loss of human life and human health, and the loss in business is enormous. So the better we perform in preventing them, and as he said, food defense doesn't make money, but the bit of money that you put into food defense will actually save us a lot of losses in the future. So that's very good advice that he has given us. So thank you once again, Hidetaka-san, for sharing this with us. So now is the time that we enter into our panel discussion, and we are very pleased that a number of very key risk managers from countries across the Asia Pacific have joined us today to talk about their experiences on managing food safety incidents, on food safety emergencies, and on preparing for the unexpected. So we've actually got very good geographical representation as well. So starting from the Pacific, then Southeast Asia and South Asia. So I'll just start by introducing them and while as they come on screen, and I'll start from the easternmost country, which in this case is the Solomon Islands. So from there, we have Ms. Ethel Leno Mapulu, who's the Director Supervising of the Environmental Health Division and from the Solomon Islands. And in the past, she has been very active in the area of food safety and food safety emergency responses. So thank you, Ms. Ethel, for joining us. And as we move west, we then go to Malaysia. We have Ms. Nurul Hidayati Suravi, who's a food technologist at the Food Safety and Quality Division at the Ministry of Health in the government of Malaysia. And she will talk about the food safety emergency response plan that Malaysia have got. And then from Cambodia, we have Dr. Aang Hoxrun, who is the Chief of Food Safety Bureau and the member of the Multi-Sectoral Foodborne Disease Outbreak Response Team, the Department of Drugs and Food and Ministry of Health, who will also talk us through about some of the experiences in Cambodia. And then moving another step west from Bangladesh, we have Dr. Taimina Shirin, who is the director of the Institute of Epidemiology and Disease Control Research, who are also the INFOSAN emergency focal point in the country, and also the lead on many aspects of One Health in the country. And then finally, from India, we have Dr. Alka Rao, who is the Codex contact point and the advisor for regulation, science, and standards at the Food Safety and Standards Authority of India. So as you can see, we have a diversity of countries. We have large countries, large economies, small countries as well. And we have a diversity of challenges that they have faced in the past and that they continue to face right now. So we will now start off with the panel discussion. And I'd first of all like to invite Ms. Ethel Mapulu from the Solomon Islands to talk us about their experience. Ethel, you did talk about the issues that you faced when the melamine crisis came to the fore about 14, 15 years ago. So can you share some of your experience, how Solomon Islands went into that situation? What was your level of preparation and how did you tackle some of the challenges you faced at that time? Over to you, Ethel.
Yeah, thank you, Srihat. I will ask Madam Anpila to show my screen or share the screen that I sent her a presentation, so if she can share.
Yes, we can see it now.
Okay, thank you, Chair. For Solomon Islands, as isolated as we are the recipients of products from overseas as well. So this afternoon I will be talking about the theme, which is preparing for the unexpected. The lessons that we learned from the melamine in 2008. Next slide. Yeah, what actually happened was the world didn't know that there was an issue in China. Children under the age of 3 years, 2.5 years, were sick. It took a couple of months before the news was broken out to the rest of the world. By then, China has responded in establishing their emergency task force. And also they have worked with the Ministry of Health in confirming that melamine was the contaminant in those milk and milk products. China then, through the INFOSAN, Yeah, the news was made known to the rest of the world. Next. Yeah, so back in Solomon Islands, it was on the 16th of September 2008 that we received an alert from INFOSAN. And the message that we received back then was keep a lookout for potential local distribution of the products. During the time, the assumption was they could have been distributed through informal channels coming into the country. And also food safety authorities to look out for symptoms for kidney failures and all that amongst children under the age of 3. There was a circulated list during that time that we have to sort of take, and then we went out searching for those products on the market, on the retail shops, few big supermarkets that we do have in the main center. So the 3 that we were targeting during the time were infant formula, canned milk, coffee drinks, and candies. Those were the 3 products that we looked at. Also, at the national level, at the time, there wasn't any food safety emergency response plan. There wasn't any imported food guidelines. We don't have that. There wasn't any resources available on the ground in terms of logistics to run around and check all the shops. And also budgetary allocation was sort of limited or scarce at that time. But then the bonus that we have during that time, we have the Pure Food Act that made us to enter shops and to check and verify if we actually have those products on the shelf. And at the same time, there was also an urgent call out to all the environmental health officers out in the provinces to check, to do a retail shop check for those mentioned products. And there were some products that were seized, and then we condemned them as well. Just for verification purposes during the time, we sent off some samples to a laboratory in Australia. That is the closest that can do the melamine test. And the results that we got back from the samples that we sent off, there was absence of that contaminant in the products that we do identify on the shelf. What could have happened if we had a lot of those products that were affected in the country? Luckily, candies that we found on the shelves that were seized, only children in the main urban center do have access to them. The other milk products, such as the infant formula, was sold mainly also in the urban centers. However, most women in the rural areas were exclusively breastfeeding their babies. But there could have been higher deaths if the contaminant was detected out in the market. The lessons that we learned from such incident during the time is having procedures and systems in place to respond to such events. This is very important, and this is crucial for a country that has limitation to laboratory analysis and all that. Because there wasn't any written procedures, we relied mainly on the advice that we got from food safety in Manila. Then the bonus that we also had was the Pure Food Act that we used, but then it was very limited too because there wasn't any regulation to supplement it. So after this, we managed to develop our system because of the lesson that we learned from this melamine contamination. We managed to develop our systems. They are not perfect, but at least we have something in place. And we also develop import guidelines to help us to assess what comes into the country. So I think that's all that I have, Srihad, for today's presentation. Thank you so much for giving the opportunity to Solomon Islands. Thank you.
Thank you, Ms. Mapolo, and thank you for sharing that response that Solomon Islands had when they were confronted with this challenge of melamine and in infant formula. And there are many lessons to learn, especially for small countries who are import dependent and have to take many precautions when it comes to imported food. And also very interesting to learn that rural women actually they escape this in many ways. And that's also one more reason why I think both FAO, WHO, and many other agencies insist on exclusive breastfeeding for children up to 6 months. So which keeps them away from many other such potential hazards. So from there, we now move on to Malaysia, and we'd like Dr. Nurul, please share your experience with Food Safety Emergency Response Plan and how do you actually go about implementing or simulating it? Over to you.
Thank you, Srida, and thank you for inviting Malaysia as one of the panelists in the webinar. Good afternoon and good evening to everyone. It is my pleasure to be here today and have the chance to share the experience Malaysia have. As all of us are aware, the food safety issues can arise not only from the foodborne illnesses, but also from unexpected events like natural disasters, power outage, and human errors. It is also crucial to handle notifications from international platforms such as INFOSAN and RESERV systematically to ensure the safety of our food supply chain. Food Safety and Quality Program, FSQP, Ministry of Health, as the competent authority for food safety in Malaysia, is responsible to lead the food safety emergency response. Collaboration and coordination among relevant agencies are necessary depending on the nature or characteristic of the food safety emergency event. Food Safety Emergency Response FSER plan is developed in 2021 as a guideline in managing food safety emergency events in order to ensure the effectiveness of the response and minimize the adverse impact on consumer health as well as any potential consequences from the event. The development of the plan is also supported by BTSF. The document is based on the recommendation from the WHO and FAO document, Framework for Developing National Food Safety Emergency Response Plans, where National Food Safety Emergency Response Plans are essential for safeguarding consumer health. For better management of the food safety crisis, Malaysia has identified relevant stakeholders to ensure the effectiveness of emergency management. This FSER plan has also been disseminated to the relevant stakeholders, such as the Department of Veterinary Services, Department of Agriculture, Department of Fisheries, and National Pharmaceutical Regulatory Agency for their reference. In the line of communication, in the FSR plan, FSQP is also linked with the Crisis Preparedness and Response Center, Ministry of Health, if there is significant risk to illness or death or an event that can create fear to the population. Based on the FSR plan, classification of the food safety events will be determined, the scale of response and level of coordination and resources required. And these are categorized into 3 levels, which are the incident, emergency, and crisis. To categorize the food safety events, there's a tool, initial assessment, is one of the decision-making tools that we use. It is a series of assessment questions that need to be answered and justified to decide the category of the food safety events. This plan also lists the role and responsibilities of all the main players for the food safety emergency response plan to ensure everyone knows their roles and action is taken based on the procedures during the crisis. And there is a clear chain of command in the plan to ensure and facilitate the operation during the FSR plan activation. And also in the plan, we also have the 6 main steps that we have to follow during the food safety emergency response plan, where there is an identification of the food safety issues, where information of the food safety hazards may be triggered from multiple sources, such as alerts from the routine information, operation information from international emergency networks, or information from stakeholders. And also the assessment of the food safety issues. This is the main steps in when we are in the FSR plan, where we will develop a risk profile for a particular hazard or incident potential of the food safety issue. And the risk profile is one of the preliminary risk management activities which describe food safety issues and their context that will guide for further action. And when there's a need to activate the food safety emergency response plan, it will be activated by the senior director. And also in the plan, it lists out the operation and management, where there is the emergency response team that will be specifically set up for the food safety emergency response plan. And when the issues of food safety can be contained, there will be the deactivation of the food safety emergency response plan. And also lastly, the plan also lists out to review, where we have to assess the effectiveness of the response plan at the end of the emergency event to identify the strength and areas to be improved to ensure efficient management. The emergency planning team will act as the secretariats to ensure the effectiveness and continuity of the plan, and this includes to test the feasibility and effectiveness of the plan via tabletop exercise or active simulation exercise. Through these years, to increase the awareness of the FSCR plan, FSQP has previously conducted briefings to these stakeholders, as well as tabletop simulation exercise from 2021 to 2024. And the simulation exercise also involved agencies related to the injected case scenario. Thank you, Srida.
Thank you, Dr. Nurul. So here we did hear a lot of detail, particularly on the way on incident classification, on the teamwork necessary, and the steps that are to be followed when responding to an emergency. So thank you very much, Dr. Nurul, for giving us that outline. In many ways, this is a sort of a lesson or an overview on how a food safety emergency response plan should actually be planned and then implemented. So thanks for giving us that overview. So from Malaysia, we go not very far away to Cambodia, and we'll now hear from Dr. Aing Hoksrun on what in the situation in Cambodia on food safety emergency response planning and what the Ministry of Health implements when they're faced with such a situation. Over to you, Dr. Hoksrun.
Thank you. Good morning and good afternoon for some country. First of all, I would like to express my thanks to FAO and to the WHO for inviting me to share information related to the food safety emergency and outbreak response. In Cambodia, we have 2 tools for the food safety management. One is the food safety law, and the other is the Prakas number 868. So the two of these tools have the purpose to improve the implementation of the food safety system for the protection of the consumer health and to enhance Cambodian food export, and to set up the institutional mechanisms for facilitating and coordinating activities from different ministry and competent authority related to food safety. So indeed, in this case, let me share with all of you about the collaboration of the intersectoral for management of the incident happen incident event or outbreak, foodborne disease outbreak. Yeah, in the broadcast mentioned that the Ministry of Health is the leading agencies to respond the foodborne disease outbreak team. In this case, we have the SIG ministry involved in the team. We established the foodborne disease outbreaks team called FORT, F-O-R-T. This team, we have a SIG ministry involved. We have the Ministry of Agriculture, Ministry of Industry, Ministry of Commerce, Ministry of Tourism, Ministry of Finance and Economy, and Ministry of Health. So we have the focal point from each ministry, and then let me open the bracket to inform you about how do we get the information from the field, from the event. So in Cambodia, we have two mechanisms to receive the information. One information we call case-based surveillance. This surveillance, we have the report from the health sector, from the health staff, from the province, and report to the center every week, every month. Yeah, and the other surveillance we call event-based surveillance. The short form is EBS. This we report, we get the report from media, we get a report from relevant agency, from health staff, or from others sectors. So when we get this information, FORD play to filter the information. Means that FORD, we have the meeting of the FORD team to identify this information is related to foodborne disease outbreak or not, or the others, or different from outbreak of food. If we identify to know the outbreak caused by food, caused by contaminated food, the team will have the meeting based located in the Ministry of Health as a center, a center of the meeting, and to identify what the measure of the risk. Yeah, is it the high risk or low risk or medium risk? Yeah, and then identify, sustain the sustained food, identify the hazard, just the orientation, give orientation, and we have the online meeting or telegram meeting with the sub-national level from the event place. Yeah, and in this case, if the sub-national level can control or can reduce this disease, so it's not need to send the officer from the national level to help. But if the the subnational level cannot control this case, so we will send the national level to support. Yeah. So what we do in the case that we support to the subnational level, so the team can collect the sample of food, the suspected food, to laboratory to identify the hazard, to identify the hazard. And the Ministry of Health played the important role to rescue the patient. Yeah, and the team has the right to hold or to stop selling the product, the suspected product. We do not allow they sell on in the market. And if the in the production, we also hold the production, waiting for the result from the laboratory. Yeah. So after getting the information from the result from the lab, we plan to announce to the consumers and producers also, and all the relevant authority to stop eating and stop selling, and we conduct the recall the product to destroy. Yeah. Okay, this is the mechanism of the cooperation of the relevant ministry, relevant agency, and other authority, the local authority, to manage the foodborne disease outbreak. Let me share with you two cases that happened occur in one in 2015.
Sorry, Dr. Hossain, sorry to interrupt. We'll come back to you for that in the next round. Let's go, and right now let's go through what all countries have to say about their food safety emergency response plans, and we'll come to you again.
Okay, thank you. Yeah.
Thank you, Dr. Hossain. Okay, so now, we heard how they are organized, and I think the acronym that they have for foodborne diseases outbreak response team, or the FORT, is very interesting. And also how they manage not just surveilling on foodborne illnesses, but then relating it to the food safety hazard, and then taking actions accordingly on the hazard that has been detected in the food. So, and that's an interesting example for many countries who are now in the early part of the process on emergency response planning. So from there, we move on to Bangladesh, and Professor Taimina Shireen will share her experiences from IDCR. And we know, Professor Shireen, Bangladesh has been a center of many situations, so we hope to learn more about the arrangement in your country. Over to you.
Thank you. And thanks for inviting me and presenting the Bangladesh scenario regarding the foodborne emergency. So now I'm going to share my screen. Okay. Can you see my screen?
Yes, we can. Go ahead.
Okay, thank you. Respected audience, good morning, good afternoon, and good evening. This is Professor Taimina Shireen. I'm working as a director of Institute of Epidemiology, Disease Control and Research, and going to share Bangladesh experience in food safety incidence management. Actually, our institute is mandated for the outbreak investigation and response in the country. So we have the Public Health Emergency Operations Center, that is PHEOC, which deal with the country's public health emergency, and with the support from National Rapid Response Teams. Actually, they are the member of IDCR, and IDCR is also hosted the One Health Secretariat in Bangladesh, and which the main activity of One Health Secretariat is to establish the collaboration across the among the stakeholders, different stakeholders who are related with One Health activity in the country. And food safety is a crucial issue for One Health Secretariat also. And we all know the foodborne illness around the world. If we look at Bangladesh, around 30 million of people, they develop foodborne illness each year. And there are some common risk factors that are associated with this foodborne illness in Bangladesh. That is the improper food handling, meaning improper food processing, packaging, storage, and environmental contamination, and wash practice is not proper in place. And thus the food poisoning occurs in almost in every year in the country following any ceremony. And then direct contamination of food with the pathogens, and exposure to the natural toxins, as well as exposure to the pesticides that are used in different type of foods. So as I have mentioned, that we are the mandated institute for outbreak investigation in the country. So how we can capture those events for the investigations? We capture those events through active surveillance, through passive surveillance, as well as we have the event-based surveillance, through different platform we get the information for event-based surveillance, that we get the information from through the hotline, print media, social media, and electronic media. So when we get when we can capture any event, our rapid response team, they are ready for 24/7, and within 24 hours, our team move and reach to the places for outbreak investigation and response. Here we can see the outbreak investigation and response that was conducted by our institute since 2014 till date. So the blue bars indicates the total number of outbreak for different reasons, and the red bar indicates only the foodborne outbreaks that happens in each year. And here you can see the frequency of total outbreak as well as the foodborne outbreak over the years. And if we just look at if we just address only the foodborne outbreak in the country that we have investigated. So here you can see the frequency of foodborne outbreaks in the country in each year. So here we can see different bars. The blue bar indicates the food poisoning outbreak. The red bar indicates the Nipah outbreak. Green bar indicates the anthrax outbreak, and the purple bar indicates the pufferfish poisoning. So here we can see the frequency of those outbreaks in each year. So if we look at the Nipah outbreak, it's also a zoonotic outbreak, but due to consumption of contaminated dead palm sap, this Nipah outbreak happens. So, and this is the direct contamination of the raw dead palm sap and by the bat, and when the people drink those sap, they directly get the infection, and there is human-to-human transmission as well. So, and we have there is another way to get to be infected with the Nipah viruses, that is consumption of half-eaten food. Though the evidence of consumption of half-eaten food is not yet evident by Bangladesh or experienced by Bangladesh. So here we can see the tree which is harvested for the collection of raw dead palm sap, and at night the bat, they used to come to those trees trees and they lick the shaded area, and also they sit on the top on the pot, and they also consume the raw date pump sap that are collected in the pot, and thus they can contaminate the raw date pump sap. And on the most right hand side, we can see a glass of raw date pump sap, and people used to drink those sap early in the morning, early in the next morning. And it's a delicacy, though we have Nipah cases in every year, but still it's a delicacy for Bangladeshi people. They celebrate those different occasions, and they used to take those raw date pump sap during the winter, because we get the raw date pump sap during winter. So how can we capture those events? We have several surveillance platform. One is the active surveillance platform, passive surveillance platform, as well as enhanced surveillance platform, meaning that enhanced surveillance platform, we prior to the season every year, we aware the people in the catchment area of active and passive surveillance sites, and we get information through these three platforms. And when we get we can capture any event. Our outbreak investigation we conduct in One Health approach. That is our human health people. They collect the samples. They interview the patients or the patients' relatives and the community, as well as our wildlife team. They search for the bat roots. They collect the sample from the bat to find the to get the Nipah virus in the bat. And we have the communication material, and we have a national guideline for management, prevention, and control of Nipah virus infection in the country. We also published several articles in our national bulletin of public health for the dissemination of the information. We have another outbreak that we face, that is puffer fish poisoning outbreak. Actually, this is very cheap fish, so the poor people or the fishermen.
Excuse me, Dr. Taimina, can we let's come back to this. You've already shared the whole example of Nipah and how your FSCR UN unit functions. So we still have to hear from India. Then we'll come back for a quick second round. Maybe you can share this example then, if that's okay with you. Thank you, Dr. Shirin. First of all, our compliments to Bangladesh for actually showing extensively the One Health approach, how it is being used to tackle food safety emergencies. And the Nipah virus is quite a common problem in the Southern Asian region. So this is a very good example for all of us to pick up and see what are the good practices that we can take up and propagate. So before we start the second round, I think very important now, let's hear from India. We have Dr. Alka Rao. Dr. Alka, thank you for waiting so patiently. And first, we'd like to first hear about the Food Safety Emergency Response Plan, which the FSCI has developed, and how you can, what are some of the things that you have learned while you're developing that? Over to you, Dr. Alka.
Right. Thank you so much, Mr. Sridhar. I congratulate everyone on this wonderful morning, and I also congratulate everyone for this Food Safety Day celebration, which continues till date. So today we have gathered to discuss our response system in case of emergencies in the area of food sector, food safety. Here in India, we have developed a framework, food safety, under our Act, Food Safety and Standards 206. Our section 16.3 empowers us to identify the emerging risks and introduce rapid alert system. And in compliance with the Act, around 2019, we started our deliberations. And the first step we took was we issued the directions to our state to nominate a food safety officer for rapid response system of an integrated disease surveillance program of National Center for Disease Control. Now, this entire activity is implemented under the Ministry of Health, and FSSAI being one of the partner organization. At the same time and in parallel, we developed a mechanism and a guideline on food safety emergency response. So FSER framework has one national emergency contact point where one of the FSSAI designated officers serves for the coordination of national food safety emergency response, and it also serves as the emergency contact point for national and international response. We further have established a whole of ministry approach through national focal points. Whole of government approach, where we have the state food authorities, custom departments, state officer, MPEDA, NCDC, EPEDA, Spice Board. All these are different bodies, stakeholders, institutionalized under different ministries of the government, namely Ministry of Commerce, Ministry of Agriculture, Ministry of Health and Family Welfare, Ministry of Environment. So all these stakeholders together serve as a robust network of focal points who then assist our national emergency contact point and collaborate with FSSAI to provide response to emergency situations. Further, because food safety is a very, very technical subject, and nothing can be achieved without the scientific and technical experts involvement. So to ensure that, we have institutionalized a food safety risk assessment committee, which is which consists of experts from ranging from epidemiology, the risk assessment in the area of food, our statisticians, health professionals, chemists, and all those expertise have been brought in the Food Safety Risk Assessment Committee, which is in place since 2021. It's the time since these guidelines were notified and issued to the state for implementation purpose. Further, the risk assessment information is submitted to a Food Safety Coordination Committee. Now, this Food Safety Coordination Committee is the managerial committee which ensures the implementation and management of the recommendation coming from FSRAC or the inputs coming from the national focal points. So all the inputs are taken into consideration, and then Food Safety Coordination Committee advises National Emergency Contact Point also and ensures the implementation, once again with the help of all the stakeholders. It is the Food Safety Coordination Committee which will also ensure the implementation of various emergency response phases. So these phases also have been outlined in the guideline document, where we identify that first phase would be an alert phase, which also includes our engagement with the INFOSAN Secretariat, and our emergency contact point provides input there, and also to the media or to the other organization, government stakeholders, and to the people or the masses in general. So the action phase again is also closely monitored by the National Emergency Contact Point under the guidance of Food Safety Coordination Committee. Communication is one of the major area, and FSSAI has another provision of Eat Right, basically the whole of society approach. Not only so any kind of emergency response is best managed when the society is also involved, the stakeholder or the consumer is also involved. So to implement that, we also run a separate program, Eat Right India, which is again linked to this entire mechanism of food safety response, emergency response ideology. I think one very wonderful example which I can cite, which within this same framework, we have successfully implemented now the plan of foodborne illness outbreaks in India. So emergency response to tackle these issues has been implemented with the help of Ministry of Health and its National Center for Disease Control. So we are a partner organization with NCDC in implementing this particular program of foodborne disease outbreak. We have successfully across all the states made rapid response teams where the district medical officer, district surveillance officers, and state surveillance officer remains a part of this rapid response team. And from 2019 onwards, food safety officers in each of our state committees, they are also an integral part of this rapid response team. Now, the function of this rapid response team is to assist the state health food authority in investigation of foodborne illness or outbreaks, to identify the cause of outbreaks through environmental investigations, laboratory analysis, and epidemiological analysis. Then further to track the cases and complaints linked to the consumption of food and to make recommendations and take necessary steps for the prevention and control of foodborne illness. Now here the channel of communication is through the state authority to the FSSAI and then to the all the other stakeholders. And I'm very happy to inform that this system has been working very effectively for past several years now, if I may say. From 2020 onwards, this linkages with NCDC has been successfully established with FSSAI, and regular outbreak monitoring is going on, which includes foodborne outbreaks. And we also have a regular weekly update on it, action taken report, the status, and also the monitoring status of all these food outbreak cases, where the under surveillance or any other action taken report is also compiled on weekly basis. And the data is maintained centrally by NCDC and also shared with FSSAI in a regular fashion. So here the action taken report is coming weekly basis. So the other measures, the response measures are also managed in the same speed. And most often than not, we have been facing instances where so India is a very religious country, so that we come across instances where in religious functions or functions like marriage, where the large gathering is there, so food poisoning cases are reported. And invariably in all these cases, one of the response which has become very popular over the year is society engagement, community engagement, and sharing with the people the good hygiene practice. And all those activities are successfully undertaken under e-tribe mission in parallel to the food safety officer engagement with the people at the site of outbreak and also during the monitoring phases. So that's all I wanted to share today. And if there's any further question, I'm open for that. Thank you so much.
Thank you, Dr. Rao, and thank you for sharing the experience. Obviously, India is a very big country, and it is the decentralized functioning of the FSSAI that actually gives the effectiveness to the response system. That's the only way to reach each and every corner of such a big country and a big population. So thank you for sharing that experience. So we are actually slightly behind schedule. So what I would suggest is we will just ask every panelist once again to give a very quick couple of lines on what have they learned and how are they prepared for the next one. You can't prepare for anything which is totally unexpected, but you know that you can expect the unexpected. So what is your primary learning so far? So let's go very quickly. We just have about a minute for everybody. So can we start with Ms. Mapolo, Solomon Islands?
Yeah, thank you, Srihat. I think what we have from here is building the capacities of those who work in food safety so that they are equipped when there is an incident that comes up. They are equipped with knowledge so that they can go out and investigate if there is a foodborne or there is an incident. So building the capacities of the inspectors is a priority for Solomon Islands. Thank you.
Thank you, Ms. Mapolo. So indeed, capacity building is also a message for both FAO and WHO to support that in every way possible. So thank you, first of all, Dr. Mapolo, for joining us. I know it's late already in the Solomon Islands, but thank you for taking the time to be here today. Then over to Malaysia. So Ms. Nurul, what do you suggest is the way forward for Malaysia, given your experience?
Based on our experience in the food safety emergency response, the cooperation and communication between agencies is very important and crucial for us to ensure the emergency cases can be contained, and the procedures that we have during the emergency response for the emergency response team, they must have a very good procedures to ensure all the steps that need to be taken has taken, like for the recall, and also the communication to the public is very important for the competent authority to share their advice to the public during the crisis. Thank you.
Thank you, Ms. Nurul. Thank you for emphasizing the point again, coordination and the mechanism and procedures to be well in place for an FSCR to be well implemented. So again, also thank you for us. Thank you to joining us in this webinar and sharing your experience. So over to Cambodia, Dr. Hoksoon, what would you say for Cambodia?
Yeah, thank you. In this case, let me share some points that we can get the success in the response for foodborne disease outbreak. The first one is strengthening the capacity building to inspectors and for FOR team. Yeah, and we cannot forget about the exercise, the stimulations for their capacity building also. And the second point, the collaboration is very important between the public sector and private sector, relevant agencies. This is the local authority, and with the international, we cannot forget the INFOSAN. INFOSAN is very important, and we get the benefit from INFOSAN, yeah, to handle the issue, to get the success in the to handle to settle the issue that happened with the contaminated food from the INFOSAN information. Thank you.
Thank you, Dr. Hoksoon, and apologies that we couldn't have the second example from you. That might have been very interesting, but thank you also for pointing out the importance of having an international platform like INFOSAN, which actually brings all this information together and many lessons learned from across the countries. Then over to Bangladesh, Professor Taimina, what would be your takeaway message for all of us here today? Okay, I think maybe she's away for a bit. So let's go over to Dr. Alka Rao in India.
Thank you so much, Dr. Sridhar. I understand that in India, we have a very robust framework. So framework is good. However, we feel that there's been delay on our part in implementing some of these elements or institutionalize them. So those delays we have to look at on priority, and then another most important thing is to fill the gap in information. So in a robust response system, the one critical factor is information gap shouldn't be there. So for that, we identify that some of our integrations and the portals are not in place. So we are aiming to do that on priority so that the information gap is bridged. Then comes the action point. So as far as public sector is concerned, government organizations are concerned, we are really good in even coordination wise. It's, I would say, good and can be improved always. But we have not been effectively engaged the private partners. I think in a response system, maybe we need to think something out of the box, because food safety is everybody's mandate and everybody's responsibility. Our act empowers that. So that is one area where we think we need to be a little more innovative in our approach. And we are hopeful that we'll come up with something more practical in this. Thank you so much.
Thank you, Dr. Alkarao, for giving us that message on indeed constant improvement is an underlying message in all food safety activities. And finally, let's go back to Bangladesh to hear from Professor Taimina. What's your takeaway message?
Thank you. Actually, we have the legal instrument that is the Food Safety Act, which enacted since 2015, and for the to look after the food safety, safe food and to ensure the quality. And under this act, the Food Safety Authority is working. Another thing is we have some few best practices like we have the rapid response team to respond any outbreak related to food. We have the capacity for risk factor analysis, risk communication, community engagement, and if there is any foodborne illness which is associated with the zoonotic sources, in that case we investigate the outbreak in One Health approach. And one important thing is from a foodborne outbreak, we also developed a student guide for the field epidemiology training program. But still we have some limitation, like there we need more coordination across the relevant sectors which are related with these food safety issues and to ensure the safe food in the country. And we have some limitation in the limited capacity for detection of preformed toxin, which is responsible for the food poisoning, and to identify or detect the level of the pesticide in the food, and also to detect the TTX, that is tetrodotoxin, which is responsible for the puffer fish poisoning in the country. Over. Thank you.
Thank you, Professor Shireen. So we need a lot of lessons here for countries on the One Health approach, on making sure that capacity is in the country, and at looking at various aspects more than that what we actually set out to do when we made an emergency response plan. So first of all, respected panelists and dear participants, I mean, this has been a very interesting and engaging conversation all through. And just to share with you, when we started doing these joint webinars, we actually started off with an hour. We extended to 1.5 hours, and now we've gone to 2 hours, and still we actually have so much interest around the region. So maybe we need to start thinking about half a day for this in the future. So thank you all very much, and thank you all for taking the time. Now I'll pass it over to Jessica for the final remarks for the webinar. Over to you, Jessica.
Thank you very much. And I have to agree, we keep getting more and more inputs and valuable contributions from all the participants and all the speakers. So I think we did have a very good discussion. I think we went from Japan showing how to manage food safety incidents, and also the different actions from food safety and food defense actions, and how much valuable the trigger of the consumers towards a complaint can also indicate food incidents. We had examples from the Solomon Islands, especially showing how much value INFOSAN actions have to trigger food recalls, and also how this actually contributes to a good part of Pacific Island countries on that rely on food imports. And how much relevance the national legislation has to support what the member states to respond to emergencies. And well, very important network. Malaysia bringing the relevance of food safety emergency preparedness plans and how it contributes to their national actions. Cambodia showing the different types of multi-sector collaboration and coordination mechanisms, like FORT, for example, to contribute to food safety incidents, but also beyond in other food safety topics. Bangladesh with a great example of the One Health Secretariat and how much food safety is being prioritized in country within the One Health umbrella, and reminding that this is also one of the priority action tracks within the One Health quadripartite, WHO, FAO, UNEP, and WOA, as food safety, one of the priority action areas. And India also showing how much risk communication, community engagement, and well, the rapid response teams compositions and responding to food safety incidents across the nation that also added a lot of value to our discussions. Well, we come to an end of our webinar today, and I really would like to extend my gratitude, our gratitude of the organizing committee to each of you that actually participated today, rather watching us through YouTube or engaging and connecting in the webinar. I think that today's team, Food Safety Prepared for the Unexpected, gave us a lot of insightful discussions and showing the importance also of preparedness in safeguarding our food systems, right? We have explored different facets of food safety. We went through an understanding of the different risks and different hazards that can trigger food safety incidents. And we also reflected a lot on our responsibility, our collective responsibility towards food safety. Rather, if we are policymakers, an industry professional, academics, consumers, because we all are consumers, we do have our contributions toward food safety. And I think that this, it's great for us to carry a couple of the lessons learned and the experience shared by the experts that were here with us today. Before I close, I would like to extend a special thanks to all the participants, to the panelists that took their time in the different time zones to accommodate in their busy schedule, but also a big thanks to the organizing team, for all the FAO colleagues, all the WHO teams that were involved and doing the work in the background to make this webinar happen and to make it also successful. Hoping for us to continue improving and to continue promoting this type of actions to you all. And well, thank you very much once again for your participation. Please stay safe, continue to be informed, and continue to be the champion for food safety in your communities and your countries. Thank you very much, and everybody have a great day ahead. Thank you very much.
Thank you. Different.